Hey everyone, welcome back to another Fun Fact Friday. I'm Dr. Sam, and today I want to talk about something that is near and dear to my heart. It's something that I've dealt with recently. I want to kind of talk about, from a broad spectrum perspective, cancer in our pets. Our pets are living longer, and this is amazing. We've got large breeds that used to only live to be 8 to 10 years old, living to 12. We just had possibly the world record oldest cat here yesterday. They've submitted it actually for the record at 26 years old. So our pets are living longer and longer, but because of that, we are going to see things more and more like cancer, especially things that are age related. So I wanted to talk broad spectrum a little bit about how do we find these things? Because I get asked all the time, hey doc, can't we see that in the blood work? And I wish, because blood work is so easy and it's non-invasive. And so I wish that we could just find these things in the blood work. And some cancers we can. It really just depends on what organs are involved, the sensitivity of that organ, like things like our spleen and our other organs like that. They are more sensitive, and we may see them show up on the blood work without a lot of cancer there. Pancreas is another one. But then there might be other organs like the liver, the stomach, and the bladder that it does take, it gets to a point before we see things on our blood work. It has to get pretty invasive. And so this happened personally with my old English sheepdog who got liver cancer, and her blood work was always perfectly normal, even up to 3 days before we did the ultrasound to find it. And so what I want to stress upon you guys is how important you are as a pet parent to finding these things. You noticing some of the things that you notice that you may think is no big deal or is an age change or they're just getting old. Urinary changes, appetite changes, changes in behavior and mood, these things that you notice that you may kind of think is a throwaway, let us know them, because we may hear that and that may trigger us to think, oh, that could mean there's something wrong with the bladder because they want to go out so much more often as an older dog. Things like that. So please let us know. I know sometimes, especially if you have an older pet that maybe has some illnesses and you're in here often throughout the year, that you may feel like you've been asked so many times, what are they eating? How's their appetite? What medications are they on? Have there been any changes at home? And it may feel repetitive. I get it. But my nurses and we are asking these things because that might be that little nugget of information. Now we need to help you find out something that's going on in your pet that maybe you didn't even know was going on. For my sheepdog, it was appetite changes, and she's always been a finicky eater, but it had really taken a more dramatic change recently. So those little changes are the things that we may use to get you that diagnosis. We now have Dr. Page that comes here and does some ultrasound for us as we schedule it. And that's another key, more imaging capabilities, being able to send our x-rays out for consultation with a radiologist. Because although I do a lot of x-rays and see them all the time, I'm not a radiology specialist. And so us being able to send those off for a specialist to look at them. These are some amazing tools that we have here that we can use to help diagnose these things in your pets. But we have to have the inclination that we need them. We have to have something from you guys or from what you're seeing in your pet to say, we need to take x-rays. We need to go to ultrasound. And sometimes it's not always changes on blood work. Sometimes it is, but not always. So we can get into very specific things we see with very specific kinds of cancer. But as a broad idea for us to know that it's the next diagnostic step truly does take our partnership with you, the pet parent, to let us know and to let my nurses know when they're getting those history questions that something's changed. Even if you can't put your finger on specifically what has changed, even to just say something's not right. I always tell my nurses and other doctors that I coach here and you guys that nobody knows their pet better than the pet parent and the owner. And even though you might not see something right away, if they know something's wrong, something's wrong. And we need to keep looking until we find it, because you guys are with your pets all day, every day. You know when something's not right. So I hope this gives you guys a little insight, especially because not knowing about blood work, you may feel like we can get more out of it than we can. It's a great and fantastic tool, but it doesn't tell us everything. So we have other great and fantastic tools here, and we need your help to know when we need to use them. So I hope this gave you guys a little idea of what's going on with our older pets. Give this video a like and a share. Share it with your friends out there that may always feel like, you know, they're not a part of that care. You are such a part of that care and are so important to making sure we know what your pet needs. Again, always leave a comment below. Tell me what you want to hear about. I always want to talk about what you want to hear about, and give this video a like and a share, and I'll see you next week.